Dear students, today's class is on eruption and shedding. So, we will be seeing about what is eruption, what are the different types of eruptive tooth movements, and what are the theories of tooth eruption, and also about shedding of teeth and the pattern of shedding. So, what is eruption? Eruption literally means breakout, that is to come out. So, there are many definitions given by so many authors for eruption. But in general, it means the movement of the tooth through the bone of the jaws and the overlying mucosa to appear and function in the oral cavity. So, there are some phases for eruption. It is divided as a pre-eruptive phase, then eruptive phase and post-eruptive phase. Like pre-eruptive phase, as the name indicates, it is the movement that is made by the deciduous and permanent tooth germs within the tissues of the jaws before they begin to erupt. Eruptive phase means it indicates the actual phase of eruption. That is, it starts with the initiation of root formation and it is made by the teeth from its position within the bone of the jaws to its functional position in occlusion. And eruptive phase alone has intraosseous and extraosseous components. And post-eruptive phase means it takes place after the teeth has reached its occlusal position in the jaws. So what will happen actually in pre-eruptive tooth movement? As I said earlier, pre-eruptive tooth movement, it is a movement made by both the deciduous and permanent tooth germs within the tissues of the jaws before they begin to erupt. So what will happen is within the jaws, all the tooth germs will grow rapidly and then they will become crowded. This crowding will be relieved by the lengthening of jaws and the deciduous molar tooth germs will move backward and anterior tooth germs will move forward and also the jaws will begin to lengthen. So during this phase, the growing tooth moves in two directions. One is bodily movement, the other is eccentric movement. So one is bodily movement, other is eccentric movement. So this is eccentric movement and so this is anterior teeth and the position of anterior teeth and the position of posterior teeth. That is this indicates the movements made by the anterior and the posterior teeth within the jaws. And histologically, what will you see? There will be bone remodeling inside the bony crypt wall for both the bodily movement and the eccentric movement. And eruptive tooth movement, as I said, it is the axial or occlusal movement of the tooth from its developmental position within the jaw to its functional position in the occlusal plane. So the actual eruption of tooth is when it breaks through the gum is only one stage of eruption. So histologically, there will be degeneration of connective tissues immediately overlying the erupting teeth. And the eruptive pathway will be formed by the altered tissue area overlaying the teeth. And there is something called as gubernacular cord and gubernacular canal. Gubernacular cord is the connective tissue that overlies a successional tooth that connects the lamina propria of the oral mucosa by a strand of fibrous connective tissue that contains remnants of dental lamina. We can just simply say that it is a cord of connective tissue that is going to overlay the successional tooth. That is gubernacular cord. So, what happens is during the moment of tooth eruption, the connective tissue which is present in the cord will get degenerated and a pathway will be created. Through that path, the tooth will erupt into the oral cavity. So, that path which is created is called gubernacular canal. So, you can see some holes in the dry skull, lingual to the primary teeth in the jaws. These holes represent the gubernacular cord. So, we can see the dental follicle. Above that is a connective tissue called the gubernacular cord. It is degenerating, paving the way for eruption, and that pathway is called the gubernacular canal. So, eruptive tooth movement is as the tooth moves occlusally, it creates space underneath the tooth to accommodate for root formation. And fibroblasts around the root apex will form collagen that get attached to the newly formed cementum. The bony trabeculae which is left in the space, left behind as the tooth erupts in the pattern of a ladder will get more denser as the tooth erupts, and after the tooth reaches the final occlusal position, the periodontal fibers get attached to the apical cementum and also they extend into the adjacent alveolar bone. So these are the different stages which you can see in during the eruption of tooth, and the rate of tooth eruption depends upon the type of tooth movement. And there are some theories that are quoted for this actual eruption of teeth. The first theory is root formation theory. So what does this theory say? According to this theory, root formation, they say the tooth erupts only because of root formation, because it causes an overall increase in the length of the tooth along with the crown moving occlusally. But there were some drawbacks for this theory for which this was not accepted. One is there will be some resorption of bone at the base of the socket. And one more thing is, they said there is a sling of connective tissue called the cushion hammock ligament, and it is a pulp delineating membrane with no bony resorption. And there were also many experiments that were conducted to show even rootless teeth can erupt. So if such is the case, then how can this theory be accepted? It was not accepted. Then there was one more theory called bone remodeling theory. According to this theory, they said selective bone formation and bone resorption will cause the tooth to erupt. But again, even though this theory was accepted to some extent, there were some drawbacks. For example, the eruptive pathway forms in a bone even without a developing and growing tooth. So from this they concluded that bone remodeling is not the sole cause for the tooth to erupt, but the dental follicle is also involved. So the growth pattern of the maxilla and mandible moves teeth by selective deposition and resorption of bone. The major proof is when a tooth is removed without disturbing its follicle tooth gum, still an eruptive pathway was formed within the bone as osteoclasts widened the gubernacular canal. So if the dental follicle was removed, there was no eruption path formed. So this establishes clearly that a dental follicle is needed in order for the tooth to erupt, and also bone remodeling to take place. So there was one more theory called vascular pressure theory. This theory suggests that changes in the arterial pressure of the surrounding vessels could be responsible for eruption, but this pressure is not sufficient to sustain eruption for longer periods. So there is one more theory called ligament traction theory. There is a lot of evidence available to indicate strongly that the force needed for the actual eruption of the tooth lies in the periodontal ligament. The contraction of the fibroblasts of dental follicle can generate a force which pulls the teeth in occlusion. So the fibroblasts connected to collagen fiber, the fibroblasts are usually connected to collagen fibers by a protein called fibronectin, which is a glycoprotein. So these collagen fiber bundles have the ability to remodel for the eruption to continue. So at last, ligament traction theory is the only theory that is accepted for tooth eruption. There are other theories like bite force sensed by soft tissue dental follicle theory, innervation provoked pressure theory, equilibrium theory, neuromuscular theory. All these are very recent theories, but the only the fully accepted theory is ligament traction theory. And post-eruptive tooth movement, as the name indicates, these are the movements that are made by the tooth after reaching their functional position in the jaws or in the occlusal plane. So these movements are made to accommodate for the growing jaws, to compensate for the occlusal wear, and also to accommodate the interproximal wear. So there are two things. One is active eruption, the other is passive eruption. Active eruption is bodily movement of tooth from its site of development to its functional position in the oral cavity. Yes, we all know. But what is passive eruption? Passive eruption is apparent lengthening of the crown which will be caused due to loss of attachment or reception of gingiva. Yes. Okay, fine. So now we have seen everything about eruption. What is shedding? The physiologic process resulting in the elimination of deciduous tooth is called shedding. Of course, shedding is important for the permanent tooth germs to erupt. So the shedding of deciduous teeth is a result of progressive resorption of roots of the teeth and their supporting tissues. And the odontoclasts play a major role in resorption. And the pressure exerted by the erupting permanent tooth will decide the pattern of resorption. And the developing tooth germ of permanent incisors and canines are positioned lingual to their corresponding deciduous teeth. And the growth of premolar causes the resorption on the inner surface of the roots of deciduous molars, and the permanent tooth germ shifts apically due to growth of jaws and occlusal movement of molars. So the initial resorption in inner wall is repaired by cementum-like material, and this resorption is continuous when the premolar starts erupting. When the premolar starts erupting, and there is a mechanism of root resorption and shedding, like the pressure from the erupting successional tooth or forces from muscles of mastication and everything. On the histology of shedding, odontoclasts are resorbing cells derived from the, that is the major cell which is responsible for shedding is the odontoclast. And their odontoclasts are giant multinuclear cells with about 4 to 20 nuclei, and they are found in the surface of the roots in relation to the advancing permanent tooth. And odontoclasts are not found in the pulp chamber, and in molars the roots are completely resorbed. Sometimes all the dentin is removed and the vascular tissue is also seen beneath the translucent cap of enamel. So sometimes there can be some root remnants, or the deciduous tooth can be retained and the permanent tooth will still keep erupting, or sometimes the deciduous tooth will become submerged and then the permanent tooth can erupt, or there can be premature loss of deciduous teeth or delayed shedding of deciduous teeth. So many variations can occur. So with this we have seen about eruption, the various theories of eruption, the types of eruption, and also shedding and the pattern of shedding of teeth. Okay, thank you.